I'm Nick Page and I'm the Chief Executive of Solihull Council. As a place, as the people of Solihull, our learners, the people who come to work in our borough, you that live in our borough, we've done some amazing things over the last 6 months to get on top of COVID-19. However, what is clear today is that we now need to do more. We need to go further, deeper in getting on top of this pandemic. Therefore, today we will be announcing a whole set of new actions to help us get on top of it. I'm now going to hand over to Ruth Tennant, who is the Director for Public Health for Solihull.
Since the start of September, we've seen a real increase in the number of COVID cases in the borough. This has risen sharply from 84 cases across the whole of August to 131 just in the first week of September. There are 6 key things that we need to do to reduce the transmission of COVID within Solihull. The first of these is to spot cases as quickly as possible when they happen and follow those up so people don't spread the virus. And I'd like to thank all the Solihull residents who've talked to us about where they thought they might have picked it up. This is really vital to spotting any patterns of transmission and closing them down quickly. Secondly, we want to get testing to the right people at the right time and in the right place. We've just opened a new mobile testing unit in Solihull, and we'd encourage anybody, if they have the signs and symptoms of COVID, to book an online test. The third thing we're doing is to rapidly control any outbreaks that we do see in the borough. We will see outbreaks occurring with this particular virus, and it's key that we get those under control as quickly as possible. I'd like to thank everyone who has taken steps where they have seen cases, businesses and restaurants, is to take really prompt action, because it's that stops it spreading. The next thing we're doing is really making sure that businesses, workplaces, restaurants, pubs are all doing absolutely the right thing to follow the national guidance to keep their staff and the public safe. We have extra officers out and about working with those premises to make sure they understand what they need to do. We have legal powers, which thankfully we've not had to use yet, but we will do so if we think we need to control the spread of the virus. We're also promoting Let's Do It for Solihull. So we have a band of community champions who are spreading the word about what people need to do to control the spread of COVID. And there will be banners and stickers going out on bins just to really reinforce the message about what everyone can do to help control the spread of this virus within Solihull. And finally, we're doing everything we can to protect the most vulnerable. Earlier this week, we had to take the really difficult decision to close care homes to visitors. This is an important step, and we recognise the difficulty that this may cause for older people and people in our care homes, but it's really key that we protect the most vulnerable in our society. I'd now like to talk about some of the national steps that we'll be taking with government to further control the spread of the virus. So from next week, Solihull will become an area of national intervention. What this means is that in agreement with national government, we will be taking some additional steps to really get this virus under control. What this will mean is that from next week, and we will let you know when we have further information, there will be no mixing between households, either within people's homes or outdoors. This is a measure that's been taken in other parts of the country and is something that we don't do lightly, but we believe is necessary to control the spread of the virus. We'll also be making sure that the public understand the message of the rule of 6, so not meeting with more than 6 people, even if you are outdoors. These measures will be kept under regular review, and we hope to lift them as soon as we are able to, and as soon as we start to see the numbers start to fall. Over the last week, we've unfortunately seen a rise in the number of people going into our local hospital with COVID. This is nowhere near the levels that we were at the peak of the pandemic, but is obviously a real cause for concern, and we need to take action to keep these numbers down. I'd like to hand over to Helen Jenkinson, the Chief Nurse from Birmingham and Solihull Clinical Commissioning Group, who will talk to you about what you can do to help our hospitals.
As a nurse, it's really important that I talk to you today about the simple things, the ways we can keep each other safe. We need to drive the numbers of COVID infectivity down. We can only do this if we remember the very simple things. We need to wash our hands, keep safe space between one another, and wear our mask. By doing these simple things, we can help to keep our families safe, our friends safe, our neighbours safe, and we can reduce the number of people that become poorly with COVID and the number of people that have to go to hospital because they are ill with the signs and symptoms of COVID. Please help us to do 3 simple things: wash our hands, wear our mask, and keep safe space between one another. Thank you for everything that you're doing to help us to drive down the numbers of COVID and keep our community safe.